Hey everyone, welcome back to Nurse Crit. My name is Chasen. I'm an acute care nurse practitioner. Almost every nurse will give a dose of Narcan at some point in their career, and it's so cool to watch. It's like administering a kiss from Prince Charming, and within seconds, your patient is waking up from their narcotic induced slumber. But instead of a sweet princess grateful for waking her up, too many times I've seen patients emerge in a frantic rage as they experience excruciating pain that we just gave to them. And that's the point of today's video, to teach you all the best way to give Narcan to avoid torturing your patient. The objectives for this video are to understand how Narcan works, when you should give Narcan to a patient, and how to best administer Narcan that no one probably taught you in school. First off, what is Narcan? Narcan, the trade name for naloxone, is a medication that is used to reverse the effects of opiates. Opiates include illicit drugs as well as pharmaceutical drugs that we administer for pain. Examples of both types of opiates includes opium, heroin, morphine, Demerol, Dilaudid, fentanyl, codeine, hydrocodone, oxycodone, methadone, tramadol, and many others. All of these opioid drugs bind to mu receptors, which inhibits pain pathways producing analgesia. However, they all can cause severe respiratory depression if taken in excess. Respiratory depression means the person's breathing slows down and eventually stops completely. And that's how people die every day from an opiate overdose. Thankfully, we have a group of medications known as opioid receptor antagonists. These drugs, like Narcan, for example, competitively knock off any opiates from the mu receptors and then block them from trying to reattach. It's like a bouncer shoving opiates out of the club and then blocking the entrance from them coming back in. If the opioid drugs can't bind to the receptors, they can't cause problems. So when should you administer Narcan? Obviously, you give it when you suspect a patient has overdosed on some type of opiate. In the modern day, we are having a real crisis with recreational drugs being laced with fentanyl. Fentanyl is one of the most potent opiates in existence. It's 50 to 100 times more potent than morphine. Basically, it only takes a few grains of salt worth of fentanyl to kill a person. Getting back to when you should administer Narcan, if you encounter a patient with the triad of decreased level of consciousness, pinpoint pupils, and respiratory depression, this should prompt the immediate administration of Narcan. One of the nice things about Narcan is that it's very safe to give. By that, I mean if your patient doesn't have any opiates in their system, Narcan basically does nothing. It's not one of those drugs you need to carefully weigh the risk and benefits. It's essentially benefit or no benefit, whereas most drugs are benefit versus harm. So if you're not sure why your patient is unresponsive, it's usually worth trialing a dose of Narcan. Ironically, the only time you get adverse effects is if you're right. If the patient did have opiates in their system, then reversing it can cause a painful withdrawal syndrome. Now onto the most important part of the video, how to best administer Narcan. I have witnessed too many times where a patient received some opioid analgesic within the past few hours and now is obtunded with shallow respirations. The nurse calls the doc, gets the order for Narcan, draws it up, and then slams it in because they didn't want the patient to have a respiratory arrest. And then, invariably, the patient wakes up, starts thrashing and screaming and swearing because now they are in excruciating pain. And then the nurse has to debate whether or not to give opiates back again to treat the pain, but are hesitant because the patient was already overdosed before. Kind of like when you treat hypoglycemia and you give some D50 and then their blood sugar goes up to 300. And now you don't know if you should give insulin because you just had hypoglycemia, or do you let it clear on its own? It creates an awkward clinical situation. So my recommendation for anyone who has to administer Narcan, most of the time the order is for 0.4 milligrams, which is usually the entire vial. So you draw up that 0.4, which is 1 ml, and dilute it in 9 mLs of saline. If you're good at med math, you know that zero point 0.4 milligrams is 400 micrograms. And when you dilute it, like I just mentioned, you end up with 40 micrograms per ml. Ideally, you will have some kind of IV fluid running into the patient's IV, and you can adjust your IV pump to 999 mLs per hour. Then you attach the Narcan syringe to the injection port and push 1 ml every 10 to 20 seconds until the patient starts to wake up. Once the patient is responsive and breathing at a normal rate, you just stop giving the Narcan. It's like titrating any other drip. You want to give just the right amount to reverse the respiratory depression, but not completely reverse their analgesia. Once you have successfully rescued your patient, put the IV fluids back to the order rate and document the dose you ended up giving. If you don't already have IV fluids running, you can push 1 ml of Narcan and then flush it in. Repeat that every 20 seconds or so. The whole point is to not panic and give it slow and steady. It's so much better for you and the patient to get it right the first time and not have these large swings between unconsciousness and pain. I have done it this way, and I don't get patients wanting to kill me for completely reversing their much needed analgesia. There's a reason they needed it in the first place, so it's cruel to reverse it. Also, remember that Narcan is a competitive antagonist. So if you give too much Narcan and now your patient is back in pain, even if you give back some morphine or whatever opioid analgesic, it may not even work that well because the Narcan is blocking it. If you found this video helpful, you might also find my new pharmacology book to be helpful as well. If you're looking for a great resource that can help elevate your practice with a minimal amount of reading, then check out my book on Amazon. It's available now in paperback and ebook versions. The link's in the description below. Thank you so much for watching. It would really help me out if you could like, comment, and share my videos with your nursing friends. Also be sure to hit the subscribe button so you don't miss out on future videos. I enjoy being able to help other nurses succeed in their own practice. See you all next time.